in knowing how you're feeling today. So please, you can post on the comment section or in the chat box. In case you don't consent to to join the group photo, please do let us know. Or it's okay not to put on your video. And then we are going to start right away. So please, I request that we can have our videos on, and then Jen will support us with, getting a group picture. We'll be sharing it shortly. Thank you. This should take like in 2 minutes. Feel free to use our virtual background. We did share some emails with it. So in case you want to put it on your background, that is also fine. And you're all looking amazing. Please smile. Yes, so Jen is taking. Thank you. Please stay on because we are quite many. So Jen, you can let me know when you're ready. Great, thank you very much, and enjoy the discussion or the conversation. Over to you, Callum. Thank you.
So just one more thing, just to say that we're recording this webinar so we can share it with people who weren't able to be here today. But if anybody doesn't want to be included in that recording, please drop us an email and we'll make sure that you're not shared. I'm going to hand over, I think it's to Emily to kick us off.
To Lillian.
To Lillian, sorry, to Lillian to kick us off.
Thank you so much. Thank you, Callum and Patricia, for laying those ground rules for us. We really appreciate. And thank you, Jenny, for your photographic services. Yeah, so I'm Lillian Bagala, and I'm very, very happy that all of you have really shown us this great gesture to be attending with us this discussion. I would like to first and foremost appreciate our board member, Linda. You're welcome to be in this space to be sharing with us, who is the board chair for Irise International. Our own board chairperson, Deborah, is in Brussels, but I think because of time difference, she's unable to join at this moment. So allow me first and foremost to really appreciate every one of you in your individual capacities for having committed this time to be around to engage with us. I want to appreciate first and foremost our donors representation from Waterloo Foundation for believing in our future and vision as a dream to create the Period Equality Network that brings together a collection of all grassroots organizations and national organizations, international organizations, social enterprise collection to be able to improve menstrual health as a collective and share strategies and build best practice. I can't also forget our own Emily for the leadership that she provides as the CEO for our sister organization, Irise International. And she is so committed to this vision that she will go any extra mile to try and sustain all efforts at the East African level. We really appreciate you, Emily. Thank you, and continue to support us and all the Period Equality Network members that are on this call. Help me also to join hands and appreciate our team, the staff at Irise Institute East Africa, for the teamwork and effort that they put in to ensure that all things go smoothly and we all work together as a team to really have deliverables on time, but also learn from one another to strengthen ourselves. Thank you all, Patricia, Sarah, Injinja, Joeri, and many others that are on this call. In a special way, allow me, because this would not be possible without you, the TPEN members across board. We want to thank you, people from all the East Africa countries. We have people from Kenya, we have people from Uganda, we have people from Burundi, we have people from Rwanda, we have people from Tanzania, we have people from DRC, and people from South Sudan that have all joined in and expressed interest. So a little bit of what has been happening with the Periodic Quality Network dates back in 2020, when we had a humble chat with Emily to try and see how should we push for this move, as we are interested in having improved gender equality issues around our communities. And so one of the things that we looked at was within the menstrual health sector, there was lack of proper coordination, there was lack of sharing. And so we came together to put up a framework that would enable us as East Africa to strengthen our efforts. And so that is an initiative and framework that Emily also was able to buy into and started to champion supporting us. So related to this, we have been in existence for like 2 years now. That is why we are here celebrating the landmark of 2 years existence. And as TPEN, we have grown to 105 member organizations that constitute the TPEN. We are able to testify that since we commenced, we've been able to work jointly on advocacy platforms together, mobilizing different partner members of the TPEN to be in the spaces where we thought their voices really would matter. And collectively, we've been able to participate in the Menstrual Health Day together. We have been able to go to the National Coalition on Menstrual Health together to knock on those tables to work as a team, but also globally, connecting to the Global Menstrual Collective, the Global Period Poverty, to represent our voices as grassroots network. So I really want to thank you as members for that. We have a process for you to belong to these constituents. And basically, Patricia Humura, most of you know her, she's a face for the coordination of TPEN, and she sends out most of the communications and partnership communications. So we have a form. Most of you are familiar with that form. And anyone that wants to join the network, that is the form they fill in for us to believe, to get to know what they are doing around menstrual health and how we can join hands and support each other. So anyone that wants to recommend any organization to join the network in East Africa is welcome to contact Patricia. Patricia will be able to drop her email address so that those that are interested are able to contact her. TPEN as a network organization is committed to addressing period poverty within the region of East Africa. But this is only possible if we have global allies. And we want to keep on driving this agenda, but without the support of all the global allies around, this would not be even next to possible. But because we have already started seeing those that trust us, that believe in what we are saying, we are able to move forward. So allow me to appreciate all our donors that are here, that support us in different capacities. And we are able to report also why we are here, that Waterloo Foundation was able to really initially give us the first grant to pilot the small grants as a program. And since it was a pilot, it concentrated around Uganda because we are based in Uganda and we needed to know how this would work. So we really thank you and all those that benefited through the competitive process. We commend your work and keep sharing. We are yet to learn more about this. 7 organizations benefited from that initial grant giving, and we have been able to see their capacities strengthened and enriched, their programming, but also what is most important, the reach, impacting the rural communities and the girls that are vulnerable within their communities. Over 35,000 people have benefited from the TPEN initiative. So we still have our roadmap for 2023, which includes still to do joint advocacy together to go and implement different programs around our communities, but also generate grassroots issues that should go through the mainstream of national, regional, and global processes for us to be able to advocate. Thank you so much for being here. With that note, I would like to end and say thank you, thank you, thank you. Let me welcome my own Emily Wilson to give us her remarks too. Emily, you're welcome.
Thanks, Lillian. I just wanted to say a few short points about why I think TPEN matters, and I think how TPEN members and the Irise Institute East Africa team, how you've kind of convinced Irise International and many of our donors that your approach to period equality is the way forward. And I think if we look globally, the number of girls in school has dropped for the first time in a decade. And we're seeing progress towards gender equality really starting to reverse. And it's now expected to take another generation to close the gender gap. And so I think we're living in really difficult times. And it's really important to look at this issue and how we should be working in that context. And at Irise, we talk a lot about power. We have this phrase where we say power, not just pads. And I think if we look at power, actually, we're really not doing very well. So the UNDP Social Norm Index looks at kind of the ways in which kind of social norms hold gender equality back. And actually, even though we're making progress in participation, or we have done it in recent years, made real progress there, actually we're stalling and now even starting to go backwards when it comes to women and girls' power. And actually that's because 90% of the world's population have a deeply ingrained bias against women and girls. And we see that if we look at the power structures in our world, we see that kind of being enacted out. So at the moment, there are only 10 female heads of government out of 193 member states. And this is the kind of the backdrop against which we're trying to say to the world that periods matter. We're not only is it a context where historically there's been deep biases against women and girls. We're now in a time when a lot of that progress is really being challenged. But at Irise, we've always believed that period equality is about power, and that's why we've always been excited about it and excited about period equality because of its potential for kind of catalytic impact, not just kind of small incremental progress or change in participation. We've always believed it could be transformative for women, girls, and other marginalized groups. It's about changing the status quo forever. And so we believe in this current climate, that perspective is more important than ever before. And this power gap in terms of when it comes to women and girls needs to be really the most pressing issue for anyone that cares about gender equality. And the movement for period equality that we're all part of can really be a blueprint for the kind of change that we need right now and the kind of thinking that we need right now. And I think all of us that work on periods, we know that they don't fit easily into the frameworks that we currently use to structure our world, to think about what's important. When you put them into the paradigms that we often use, they appear irrelevant, they slip between the cracks. It's always a battle to say why they matter. And this is the systematic bias that is keeping women and girls out of power in action. This is the power gap happening kind of before our eyes. But we know, those of us that go out into the communities, that work with people most affected, we know that a period really matters. It brings in dignity, it can bring crippling anxiety, it can bring violence, forced marriage. A simple period becomes this mechanism for patriarchal oppression. And the fight for period equality, it's a fight to rewrite the story of what it means to be female. And let's not shy away from recognizing and calling it what it is. Like we're battling for a new world order, a world where people with periods don't just have more pads, but they have the power to shape the world more to their liking. That's what we're fighting for, and it's radical. And let's not forget that's what it is. And this kind of battle for change is fought in schools, it's fought in communities, in parliaments, in homes. It's about ideas, not just products. And that's why, coming back to my original starting point, that's why initiatives like the Period Equality Network are so important, because we're only going to win this fight if we stand with those grassroots champions that are making this change day by day, girl by girl, in their own communities. And the people in TPEN are the power behind the movement. They're what will sustain it during the difficult times. They're what has sustained it during the pandemic. And they're ultimately what's going to make it so that we don't need a movement anymore. And I just believe right now in this moment, there's no better, more cost-effective, sustainable or impactful investment to be made in menstrual health than an investment in the grassroots movement, in bringing them together, equipping them and helping them turn the tide for girls and everyone affected by period equality. And that's why I'm so proud of everything Lillian and her team have done so far with TPEN, and why I'm really excited to champion the next phases of their work, because I believe if we stand with them, we can change the story about what it means to have a period, what it means to be female forever. So that's all from me. And so I think we're going to hand over to Jen now to hear the key findings of our report, are much more the findings of the impact evaluation that we've recently done on TPEN. Over to you, Jen.
Okay, so I think that should be okay. Can someone nod at me that you can hear me and you can see the slides, okay? Okay.
Yeah, we
fabulous.
can. Go ahead.
Okay, so I just want to echo Emily and Lillian, say it's great to see so many people here today. I'm Jen, and I've been supporting Irise International and Irise Institute East Africa in facilitating the Period Equality Network over the past couple of years. So I have half an hour today to introduce you to a report written and researched by independent consultant Miria Solorzano, entitled The Power of Working Together, Lessons and Learning from the Period Equality Network, as well as accompanying resources designed to provide guidance for organisations delivering period equality initiatives in East Africa and beyond. So the independent evaluation, just to give an overview, was an evaluation of a 2-year investment by the Waterloo Foundation, detailed in the report, the cover of which is on the right of your screen there. And it outlines activities, lessons learned, and impacts across the 3 main objectives of the Waterloo Foundation's initial investment. The first being to build a community of best practice amongst partners and collaborators in East Africa, including mobilising UK charities and collaborators to better support their East African partners. To bridge the gap between research and practice by producing and delivering resources, training and guidance across the areas of intervention, integration, impact and inclusivity, including developing a monitoring and evaluation toolkit, a training video, a manual and an Excel spreadsheet to input data, and to collate and amplify effective programming already happening within the network under the themes of sustainable change and girls' leadership. The report also aims to capture the wider work catalysed by the initial investment by the Waterloo Foundation. So the report was built upon desk-based research, a review of project documentation over the past 2 years, and interviews with stakeholders and 18 survey responses submitted by TPEN members. The full report contains much more information than I have time to summarise today, but it will be available on Irise's website, so please do go and have a look. So this presentation will follow the structure of the report, which I've outlined here. I'll first set the scene, explaining the origins of the Period Equality Network and the work and funding that sparked its beginning. Then I'll move to explore the journey of how we got to the point that we're at today, with so many TPEN members and their allies in attendance. Then I'll move to explore the three main takeaways from this project: how initial funding catalyzed increased collaboration and impact, encouraged the successful move of small grant recipients from measuring reach to measuring impact, and finally, how it has been a positive step towards building a sustainable movement. And then to finish off, I'll provide an overview of where we find ourselves today and illustrate how we can move forward together. So let's start with a brief introduction to the project that facilitated the creation of the Period Equality Network. So as many as you know, and Lillian just outlined as well, the Period Equality Network, or TPEN, was set up in 2020 to increase coordination, mobilization and cooperation among civil society organizations working on menstrual health and hygiene in East Africa and their UK partners. The conception of the network involved collaboration between UK-based charity Irise International, Uganda-based sister organisation Irise Institute East Africa, and the Waterloo Foundation, who are a UK-based funder supporting menstrual health work in East Africa. Prior to TPEN's conception, Irise International commissioned external research on the capacity building needs of small charities based in East Africa to develop effective community-led menstrual health projects. Organisations consulted during this research highlighted that the sustainability of projects was a key challenge and that supporting local ownership was critical to achieving this. There was also growing and varied national efforts across the East African community to address menstrual health within national curriculums and policies, with significant opportunities for cross-context learning. So off the back of this research, with the support of the Waterloo Foundation, what was the beginning of the Period Equality Network, an initiative founded on the idea that grassroots groups and community-based organisations are uniquely placed to facilitate community social norm change and place girls' leadership at the heart of sustainable and effective work to realise period equality. So what happened next? The next section explores how we got to where we are today. So I've lifted this table from the report, which details the core activities funded by the Waterloo Foundation over the course of their investment. So subsequent to the Defining the Gap report, which I just mentioned previously, which is on the first box on the left, the Period Equality Network was co-created by 30 organisations in Kenya and Uganda, and supported by the IIEA team, who created communication channels for members to interact through and provided ongoing support for TPEN members over the last 2 years. So around the same time, in April 2021, Irise created the Funder Assessment Framework, which summarises the evidence and expert consensus on effective menstrual health programming. And this will also be available on Irise's website, and I'll go into a bit more detail in a little bit. So using this funder assessment framework to evaluate proposed projects, local stakeholders made up a grant-making committee, and they awarded small grants to TPEN organisations to support them in delivering their proposed period equality initiatives. At a similar time in June 2021, the Irise team developed the Monitoring and Evaluation Toolkit, which collates a broad range of indicators organisations can use to evaluate their initiatives, which was made accessible to the recipients of the small grants round. Capacity building for the grant recipients and the wider TPEN community, including training on the evaluation toolkit and safeguarding, ensued from July 2021. So continuing the core activities funded by the Waterloo Foundation, these have continued up until present day. Irise International and Irise Institute East Africa have worked with partners Dig Deep, exploring how to integrate menstrual health into Bomet County, Kenya's WASH strategy, African Revival in their delivery of menstrual health advocates girls clubs in their partnered schools, and the Young Women's Human Rights Alliance in Uganda to amplify girls' voices and support their leadership. In October 2022, we at Irise International finalised 4 learning briefings capturing the learning, resources and tools that have been developed over the past couple of years with consultation with the TPEN community. And I'll also go into this in a bit more detail later on. So today, TPEN boasts over 100 members. I think Lillian said 105. And they're based in Uganda, Tanzania, Kenya, Rwanda, Burundi, and South Sudan. So I don't have time to go into all the additional activities that have been funded from other sources through the duration of this project. But I did want to include this table here to give you an idea of the breadth of the different projects sparked by the initial investment in TPEN. This table can be found in the report as well, and I'd recommend taking a closer look to get the full picture of the activities that TPEN members have engaged in. Some highlights from this include formal recognition of 12 TPEN members for their contribution to menstrual health work in Uganda by the Uganda Ministry of Education and Sport in May 2021, the launch of the Tomorrow's Different Feminist Leadership Project in November 2021, delivered by Irise Institute East Africa with funding from the African Women's Development Fund. And this program aimed to train TPEN members in feminist leadership values and the delivery of 2 virtual webinars, bringing together TPEN members and other stakeholders from across East Africa. And this was in the regional East African webinars, which I think is March 2022, sorry, to understand the menstrual health landscape in East Africa. And then continuing on through 2022, the collective power of TPEN members has been increasingly realised as members have taken part in national and global level forums, from participating in the Uganda government's technical working meeting for the National Strategic Draft Plan for the menstrual health and hygiene in May of this year, to the first regional menstrual health symposium for grassroots organisations in the East Africa community. The collective voice of TPEN members has grown louder and louder. So moving on to the 3 main findings of the evaluation report, I'll give a brief overview of each section, starting with catalysing collective power. So TPEN provides a space where grassroots organisations and those working with them can share resources and learning, access training, and be part of an active community to support their work and advocacy with like-minded partners. TPEN has also created a space for funders and organisations to provide or access further support, and for menstrual health organisations and actors to engage in collective activities that strengthen their advocacy and programming. And these collective activities have ranged from accessing free period products to training, to funding opportunities, to advocating government together. So this diagram is taken from the report and shows how TPEN members' joint efforts have gained recognition at a regional, national and global scale in ways that wouldn't have been possible if members had been acting alone. Providing a host and organised structure to the grassroots movement has made it easier for funders, partners, national and regional government and academics working on period equality to support the movement and ensure the voices and priorities of TPEN members are represented in global spaces. The report concludes this section by describing how TPEN has created a space that recognises the effort and increases the visibility of organisations working in East Africa on period equality. TPEN has highlighted the size of the grassroots movement and the perceived relevance of the issue to young women and girls themselves and local community-based organisations and leaders. The connections that TPEN has created amongst grassroots organisations, community-based organisations, government actors and funders has strengthened collective programming and advocacy for menstrual health across the region and globally. So I wanted to give a brief overview of a case study of the Zamara Foundation and the work that they've done. So the Zamara Foundation are a period equality network member based in Kenya, and they led a petition with other East African partners and TPEN members to the Legislative Assembly of the East African Community. to include menstrual health into the East Africa Community Sexual and Reproductive Health Bill during the public hearings. Through the network of TPEN, the Zamara Foundation were able to mobilise and inform other menstrual health actors about the bill and identify how they wanted it to be improved to make commitments to menstrual health more explicit. And discussions with the Legislative Assembly are continuing. So moving on to the second subheading, from reach to impact. So Irise developed a monitoring and evaluation toolkit as part of this project to equip organisations working in communities and grassroots groups to capture the impact of their work. So as you can see on your screen, the toolkit combines tools across the 5 areas depicted here. These tools are a combination of those that Irise has tried and tested in their programming, with those that have been developed by others, including parts of the Menstrual Practice Needs Scale, the MPNS, developed by researcher Dr. Julie Hannigan and Johns Hopkins University in partnership with Irise International. The toolkit provides a variety of ways of measuring outcomes to understand menstrual health from a wide perspective, with specific information that informs the design of programs moving forward. So a key strength of the toolkit is that it goes beyond product provision and it investigates the context around an individual and how they can access menstrual health more effectively. The standardization of indicators across programs when they're used from the toolkit allow stakeholders to make data and impact comparable, not only within an organisation, but also across different interventions with different project designs. In addition, the toolkit has made it possible for organisations to track issues that they were not previously measuring. So the handbook itself contains resources on the community readiness to change approach for social norm change, a period positive environment checklist for assessing the appropriateness of facilities for managing menstruation in any given setting, a knowledge and attitude survey evaluating awareness of menstruation, its physiology and the inaccuracy of harmful myths, selected questions from the Menstrual Practice Needs Scale assessing menstrual experience, selected questions from the Menstrual Practice Questionnaire, which assess access to menstrual materials and meeting the needs associated with this access. The Washington Short Sets, which facilitates disaggregation of data according to disability. Afrobarometer designed questions, which measure individuals' lived experience of lived poverty, and ways through which to assess self-reported school absenteeism, school attainment, and girls' school dropout rates. Also included in the toolkit is an Excel spreadsheet, which is designed for organisations to input their data and track progress over time. So when organisations put their data in, the spreadsheet generates graphs, so organisations can look at them and identify key trends from baseline through follow-ups. So the evaluation report concludes that the adoption of the evaluation toolkit and the measures it contains promises a positive shift towards systematic assessment of collective impact at the community level, which is vital for building the case for more investment in period equality initiatives. The toolkit and training has helped small grantees to move from communicating their progress based on the number of people reached to focusing on impact, although many still require some support to incorporate the toolkit into their programming. Another quick case study from the report is the experience of DeFora, so the Development Foundation for Rural Affairs. They're a member of TPEN who are based in Western Uganda, and they were a recipient of a grant from Irise Institute East Africa, which supported their school and community-based outreach project. So DeFora aimed to support 1,200 girls in 6 schools through skills training, increasing the capacity of schools to support girls manage their menstruation, and to increase awareness of good menstrual health and hygiene practices among community members. So DeFore recognized the benefits of monitoring progress across the indicators included in Irise's monitoring and evaluation toolkit. And they were able to demonstrate the holistic impact of their project beyond their reach figures. They demonstrated remarkable progress over time across multiple indicators, most notably a significant improvement in the period positive environment checklist across all project schools, and an improvement from the 43% of girls in project schools reporting using potentially harmful menstrual materials at the beginning of the project to 0% by the end. And that graph there is what is the one that was generated in the Excel spreadsheet once they had inputted their data. And then the final section of the evaluation report is building a sustainable movement. So nearly all the organisations that were consulted, that Miria consulted during her research informing this report, identified the sustainability of their efforts as a key challenge, and that creating local ownership is a critical part of addressing this. So the report identifies changes in the programme design and development of small grant recipients as a result of the capacity building support, exchange of learnings and best practices within the network. These changes impacted the sustainability and long-term goals of the network members, including moving from product delivery to a holistic menstrual health intervention, engaging the broader community rather than focusing exclusively on women and girls, and enabling girls and young women's voice and leadership. The report concludes this section by stating, progress in ensuring the sustainability of community-led menstrual health work is evident, although small organisations and grassroots groups still face challenges accessing long-term funding for their work on this issue. The Period Equality Network has helped organisations adopt more sustainable approaches in their programming, design and delivery, as well as evaluation. The overall TPEN initiative has shown to be a cost-effective way to support menstrual health work across the region by enabling the exchange of learning and more effective project design. And one final case study. So Dig Deep worked with Irise to integrate menstrual health into the district level WASH strategy in Bomet County, Kenya. The organisation integrated menstrual health measures, so questions for those who are menstruating, which were taken from the menstrual practice needs scale. They integrated these questions into routine WASH surveys and then used that data to advocate that local government consider menstrual needs in their long-term planning. As noted by Dig Deep in the quote at the bottom of the screen, recruiting political support via demonstrable impact measured through the MPNS questions means that progress is more sustainable. The addition of questions specific to menstrual experience into existing monitoring and evaluation frameworks is a relatively low-cost way to ensure the needs of those menstruating are met and that progress is sustainable. And finally, so moving forward together, the final section of the report. So the Period Equality Network has evolved organically from its original conception to what it is now. Today, TPEN is a strong community that fosters synergistic action and enables more effective programme delivery. There is evidence of numerous ongoing interactions inside of the community that create value for all its members, and the community has and is evolving from a centralised model, so the on the diagram, the one on the left, that places the power in the funder and key partners, into a decentralised model that shares power across the community, which is the diagram on the right. So this approach is not without its challenges. The numerous organic activities happening within the community can be quite difficult to capture. And as you can see from the graphic on your screen, the exchanges of knowledge and resources between TPEN members has become more complicated over time. The accelerated growth of the network to many countries has increased the need for training, support and funding. But nevertheless, TPEN has had and is having a strong impact on menstrual health advocacy in the East Africa region with global reach, as network members are supported to build consensus and take action together. And very briefly then, just to finish off, so I've outlined throughout this presentation some additional resources that have been created to support organisations design, deliver and evaluate their period equality interventions. And these will be made available online. The funder assessment framework outlines what we understand to be best practice in menstrual health programming, and is constantly evolving as new evidence emerges. But it is hoped that this framework will assist both funders and small charities in supporting equitable and effective menstrual health interventions. Then the evaluation handbook and the monitoring and evaluation toolkit. Irise has put together a handbook and accompanying Excel-based toolkit to aid organisations in designing their M&E activities. So the resources included in this toolkit balance accessibility with best practice across a range of relevant indicators, which I briefly outlined earlier. The Community Readiness to Change Handbook provides a step-by-step approach to using the Community Readiness to Change approach in menstrual health, based on Irise Institute East Africa's own experience of implementing it. And this approach helps organisations evaluate the community across 6 different dimensions of change, providing insights into where the community is in terms of progress towards changing a social norm. And then subsequently, this information captured using this approach can then be used to help design interventions moving forward. And then finally, the 4 learning briefs, which come under the themes of intervention, impact, inclusivity, and integration. These provide an overview of what has been learnt over the course of the last 2 years, collating the experience of TPEN members, as well as the expertise of experts in menstrual health. And this is all around how to design, deliver, and evaluate period equality programs in an effective way. So these briefs overall are intended as a guide to help organisations tailor their approach across the 4 topics as they continue to deliver impactful programming. So thank you for listening, and that's all from me. So back to Lillian.
Wow, thank you so much, Jenny, for that deliverance of such a powerful report, but yet summarized. I hope members can really have takeaways on where the journey has started us from and where we are up to right now. Allow me to invite Emily to guide who is coming in next. Emily, please.
It's over to Patricia for the some TPEN members to discuss the positive impacts of TPEN and their priorities for next steps. So over to you, Patricia.
Thank you so much, Jen, and I'm really proud of the Period Equality Network. I'm proud of everyone. So I think before I can invite my panelists, I would like us, if you are part of the Period Equality Network, if you are a member, when did you join? Just share in the chat box. Tell us, when did you join the network and what have you achieved so far? You don't have to write a lot, just a sentence, maybe Feb 2021, sorry, maybe Feb 2022, and this is what I achieved. And if you're a stakeholder, just post what you think of us as network members. Yes, so I invite the panelists who are part of the Period Equality Network, who are excellent, who are champions, they're experts in their work. I would like to invite them to all be able to put on their videos, but I am going to first invite Esther Wambui from Zamara Foundation. Esther, you're welcome. We need to see you, yay! And then we have Don Zen from Awesome Mind. Don, you're welcome. We need to see you. These are network members. You can see them, they're ready for us. And then we have Christian Katekene. Christian, where are you? We are also excited to see you. And then we also have Charles Tumwebaze. So this is Christian. Thank you, Christian. You can wave to us. And then, yes, so I will start with Esther, and then we can have all the other panelists come in. Esther, just briefly tell us, why do you think period equality matters? And you can tell us in the context, maybe to the people you work with in your community, why do you really think that it matters? Thank you very much. Over to you, Esther.
Thank you very much, Patricia, and really thank you for having me. Just to also mention that it's great that you've been featured in the report. I am from Zamara Foundation. And I think for me, what I can say is that, period equality really does matter for women, girls, and gender expansive persons. And why for us as a feminist organization, we use the language as gender expansive person, because we realize that, there are people with different genders that actually menstruating. So let's say transgender men that are still menstruating. But then, of course, then the aspect of, why it matters, it's because then, the aspect around affordability, accessibility, and safety when it comes to menstrual products. But then again, we also need to understand that the menstrual equity is not just about products. It's also about education around sexual reproductive care. And the many young women and girls that we work with do not have a choice in terms of, the choice of products to use. So you find that what they can use is what is either they're given. So they can't say, oh, I would want to actually use this product because then this product is what I really like. And because of the fact that they don't have that choice is also why we do this work. But also our support is also to ensure that we really do advocate for systemic change, because we realize that, at times it also goes beyond providing products, is to ensure that we, try to influence the policies and the laws and processes that will ensure that, women and girls and gender expansive persons have access to the choice of sanitary they need. Also, like they have dignified menstruation and the whole aspect around menstruation health hygiene in terms of where are they changing their products, do they have access to water, and how far do they have to walk, are they missing school? So the whole component and the holistic approach, in terms of really period equality, that's what really matters to us. And we ensure that then we work together with the different systems that we have in Kenya. Kenya has been seen as one of the progressive countries with a menstruation health management policy, with, and with, of course, removal of tax, but then it needs to go beyond that. And being in this network enables us to really think through how do we, ensure there is period equality when it comes intersecting the different issues, such as, of course, mental health, of course, the aspect on sexual reproductive health and rights, and also gender-based violence. So I think for me, that's how I can say why it does matter to us, and in terms of how we do the work that we do in supporting the young women, girls, and gender expansive persons. Thank you very much. Over to you, Patricia.
Great. Thank you very much, Esther. We are really so excited to learn about the intersection that comes in with creating or using the feminist perceptions, especially in your country, Kenya. And well done. Next panelist, Don Zen, who is a vibrant young, youthful man who works with Awesome Mind Speaks. Don, we request that you can unmute in case you're not able to share your video. I will share his picture to tell us about the importance or the relevance of period equality in your constituency, especially where you're working in the areas of mental health and the positive impacts, really. Thank you so much. Over to you, Don.
Thank you much, Patricia. I'm Zen, everyone, and I am part of the Period Equality Network. Period Equality Network has been a great experience for me, and also for Awesome Mind Speaks as a startup that was initially affected by COVID, and we couldn't operate. And by the time we joined the Period Equality Network, there was so much need for us. And also we were still figuring a few things out. But with the Period Equality Network, the different planning meetings we have been having with the different members, the different engagements, the brainstorming on how we can, make relevant of our, organizations and projects helped us. And then that is when we jumped on. On a project, the COVER project, which was under still the Period Equality Network. And we went in different schools talking about menstruation and mental health among the different young people, not only girls, but also including the boys themselves. And this was a very good experience for us because from it, also MindSpeaks gained visibility. From it, also MindSpeaks got to meet different stakeholders at the district level. We got to meet the cows, we got to meet the DCDO, who further got to know about also MindSpeaks and what we do and our relationship with Irise East Africa and the Period Equality Network. And then that makes our work more relevant because again, we get to talk about the intersectionality of mental health and menstrual health among the different young girls and boys, and also ensuring that we give out 150 floor cups that were provided by Irise to the young people. So Irise has done a direct impact, empowering also MindSpeaks, and also an indirect impact by empowering also MindSpeaks to empower, the different young people in the community. So for us, it's really, really a blessing to be part. And also as a very, very young organization, there are members of the Period Equality Network we look for mentorship and guidance. And so it goes beyond just even being a member to, to growth, to scaling up, but all this is possible through the network. So also MindSpeaks, we are very, very happy and excited.
Thank you so much, Don, and we are so proud of you and the team you work with. You're really so excellent. We also feel motivated and inspired by the work you do, especially when you reach these young women and girls. So I will invite Christian Katekene, who is a Period Equality Network member and a team leader of Development Foundation for Rural Areas. Christine, I will request you to unmute, and you can also, if you're ready to, share your video, that's fine. We would like you to tell us why period equality matters, especially to the young women, to the students, to the people that you work with in the rural settings of Western Uganda. Christian, over to you. Thank you.
Thank you so much, Patricia. When I talk about, good afternoon, everyone, first of all. When I talk about period equality, then I'm looking at affordability, accessibility, safety of menstrual products, but also I'm looking at privacy, and also hygiene. Sorry, I'm looking at the privacy that the young girls and women have privacy to use those products, available products. Why period equality matters is because when there is period equality, when girls have access to those products, when girls have access to menstrual products, when girls have they can afford the menstrual products, when girls can have the spaces where they can use those menstrual products in a private way, then they are able to stay in school, first of all. Then they are also comfortable in school, like they are mentally and physically and psychologically ready to stay in school. But also when there is a period equality, that means that girls have access to wash facilities in schools. For example, here we're looking at the wash facilities. We're looking at, do they have access to running water in school? Do they have access to maybe soap to wash up after when they're in their periods? Do they have access to emergency sanitary kits in school, because these are the things that we find in most cases are not in schools. But if there is period equality, then that means that girls have access to those things. Girls have access to wash facility in schools. Girls have access to menstrual products available to them, not just girls, but also young women. And then that means also girls, when there is period equality, that means girls have access to knowledge on menstrual hygiene or menstrual health. And when you have, first of all, knowledge is power. So if you have knowledge, that means like you're confident and you know what to do. And once young girls have knowledge on menstruation, which is a very big challenge in our communities, in our local communities, most of the young girls we found out that they do not even know anything to do with menstruation, and they only find out about menstruation when they actually start menstruating. So period equality matters, because once those girls have knowledge on menstruation, then they can be able to stay in school, for example, complete school, and go on, like they can be able to fully realize their full potential in school. And also this also cuts across to their mental health, because once you have access to the menstrual products you use, once you have access to the right wash facilities in schools, once you have access to privacy, because this is also another issue in most schools. You find like there is there can be a changing space in the school, but then there is no door, there is no privacy. Like you can see, like the boys, in most cases, the washrooms for the boys and the girls are just separated by a wall, whereby sometimes a boy can peep and see what is happening. So once girls have such privacy, have such privacy available to them, then they are able to fully realize fully participate in public life and fully be themselves. Period equality is matters. Thank you.
Great, thank you so much, Christian. You raised a number of issues, and I believe after Charles has spoken, we'll invite you to tell us more about the project that you implemented in your district as a grantee of the Period Equality Network small grants. Okay, so I will invite Charles Tumwebaze, who is the Executive Director of Together Alive Initiative and the President of AFRIAN Uganda. So Charles, you're going to tell us why period equality matters, especially in line with the sexual and reproductive health and rights angle that you're working in. Over to you, Charles.
Hi, everyone. I'm really so happy to be here. I couldn't wait for this day. I'm hoping I'm very clear, loud and clear. Yeah, my name is Charles Tumwebaze, and I work with the Together Alive Health Initiative. It started as a CBO way back in 2014, after we discovered that there were so many girls that were missing school, dropping out of school, getting pregnant because of lack of menstrual products. Why does it really matter? I think Esther and my friend Christina have really elaborated that really well, but I can add my voice as a man that I'm a product of a missed period, you know. And so I am a champion. I have a friend of mine who doesn't believe in men being MHM champions, but I think for me, I'm one, because I've been able to at least empower girls with information and everything they need to go through their periods. But why does it really matter? Period equality is really important, because we know when girls have no access to these products, some of them will actually miss school. They actually, some of them have pads, but they can't afford to go to school because the school environment is not friendly in a way. I've been in so many schools in Uganda, and some of these schools, I actually have like one toilet or two toilets, which are actually also very far away from the school, bushy and all that. And these are the places you would expect the girls to use to change pads. And so in such an environment, how do you expect a girl to stay in such a school? She would rather stay at home when she is in her periods, to ensure that she has privacy to change a pad. And so it's not really about even having a pad, but is the environment friendly for this girl? And so if she misses school, it is frustrating. If she's frustrated, the more she'll drop out of school. If she drops out of school, the next time she'll get pregnant. If she gets pregnant, the pregnancy might also be a miscarriage. If she gets a miscarriage, she might die. And so you see that there's so many problems around just that part. And so that's how my organization came in to ensure that we can create an enabling environment where girls are firstly given information. And I'm really happy that Emily talked about that period equality is all about power. You know, it's not just about a pad or a washroom or something, but it's information. It's information you're giving this girl power to decide, power to negotiate. And so it's really important. And some of the cases that we have, we all know that we have about 25% of girls in Uganda between the age of 15 to 19 are either pregnant or they have a child. But it's because of these kind of problems, lack of pads and poor environment. We know that most of our schools do not have changing facilities. I was in Tororo, and the only place that had something similar to what we really want was a place that was funded by Plan International. And so government is not out. Yes, we really appreciate government, but I think there is a lot of work to be done around our facilities when it comes to building schools, so that each school that has been built, at least there's a facility that has running water, emergency pads and all that. And I'm really so thankful to, maybe I'm getting to another question, but I'm really very happy and grateful to Lillian and the entire team at Irise that have worked together with government to ensure that we influence policies that talk about ensuring that we have such facilities, emergency pads, ensuring that we can increase the budget, the capitation grant of 10,000 to at least maybe 25,000 per girl, so that we have all these facilities in schools, but we also have the pads in the schools. There's a school we went to still in, I think, Kamuli district, where we asked these, actually it was still Tororo. We asked the headmaster, why don't you have emergency pads? And he was like, we are given very limited money, and the only money we get is only enough to buy chalk. I don't know whether you know chalk, but that thing they use to write on the board. So they could only afford maybe chalk and a few necessities for the school, but they couldn't afford to buy emergency pads. So thank you so much, Patricia. And I look forward to the next question. Thank you so much.
Thank you so much, Charles. We really appreciate you for joining us and for sharing. And we recognize some of these issues, and we take note. The joy of having a period equality network is because we do collaborative advocacy, and I believe when we are tabling these issues, we will, break the glass ceiling. So I'm going to invite Christian again. Christian, I would like you to tell us how the Period Equality Network has contributed to the establishment of stronger links, a community that is, working towards ending period poverty in the district where you implemented as a small grantee. Tell us about your project. Tell us what really stood out. Over to you, Christian. Thank you.
Thank you so much, Patricia. I realize I didn't introduce myself and my organization. I'm Christian Katiekaine. I work with the Development Foundation for Rural Areas in Chegegwa District in Chenjero District, but we're implementing in Chegegwa District in Western Uganda. I'm proud to say I was a grantee for the Period Equality Network, and we are able to implement a project strengthening menstrual hygiene in 6 schools in 2 host sub-counties, refugee host sub-counties in Chegegwa district. And with that, the activities we're able to do, we're able to carry out 6 trainings in 6 schools, that is in Chegegwa district. And in the trainings, we're training the trainings were in primary schools, 6 primary schools. And our trainings mainly focused on menstruation, because it wasn't, the project was about strengthening menstrual hygiene, but we had to start directly, like start from the core, start from the beginning. What is menstruation? Because realize that is one of the things like the young people do not know or do not understand the classes we're dealing with. So we focused on menstrual hygiene, but also menstrual hygiene management itself. That is, we're looking out in schools, we're looking out, these schools have the right wash facilities for these young girls to be able to stay in school and to be able to complete school. For example, we're looking out for, do they have running water, available running water? Because really some of the schools actually have the tanks, but they do not have the water. They do not have the running water. So that was one of the challenges. The other thing we're looking out, do these schools have the changing rooms for the young girls when they are in their periods? That was also another challenge which we're facing in most of the schools. Some schools actually have the room, but then there is no door, there is no curtain, there is nothing. So that means if you're going into that room, everyone can see what you're doing. You have no privacy. Also, another thing we're looking out for is do these schools have the other things to use, like buckets, for example, buckets or soap? And in most cases, some schools were trying, they do have those things, but then some other schools did not have any of those things. But the positive part about that is after our project ended, we keep in touch. We're still in touch with the schools and the people we worked with. So a few, like two head teachers, one from primary school and another school called Wekomire. Those head teachers were able to call us, like excited to inform us about their progress. Like now we have a safe space, and now our water tank is working. Like we now have water. So that is like a success. You're like, oh yeah, now we did something at least. The other thing we're looking out on the training of the young girls were the taboos and surrounding menstrual hygiene, the cultural beliefs and all those, because those things are still like 100% happening in our communities. Like, for example, if a girl is in their periods, they're not supposed to be, some of them are supposed to stay home. You're not supposed to be moving in the community where other people, you're not supposed to do. There are some things that young girls are not supposed, not even just young girls, but also women are not supposed to do or are not allowed to do in their communities when they're in their periods. Also, another thing that we focused on during our training in the schools was around the stigma on menstruation, and our trainings were ensured that actually I can tell the truth that at first we went with the idea of just let's say sensitizing the girls, but when we reached there, we're like even the teachers themselves are like, yes, you're talking to the girls, but the boys also have the issue. Like they're the ones who are stigmatizing these young girls when they're in their periods, like laughing at them, making jokes. For example, a girl starts her menstruation and she doesn't have the rate. She doesn't know, first of all, that she's starting, but also because maybe she doesn't have
Christian, sorry to interrupt you. Just have a few minutes. Sorry. Thank you.
Oh, sorry. Okay, let me finalize. Okay, sorry, Patricia. Then another thing we did was we had 6 community dialogues in our communities. Also in the dialogues, we had stakeholders like teachers, parents, local leaders, religious and cultural leaders, VHTs. Also, another thing we're able to do was provide emergency sanitary kits to schools, to the schools we're working with. Those included reusable sanitary pads, soap, and then buckets. But another benefit or advantage of being part of the Period Equality Network was we're able to gain visibility for our organization through the different period equality platforms. So, for example, when we share our work, we're able to tag the different Period Equality Network members. But also another thing was sharing and learning on the different platforms, because you are able to see on a daily basis someone is posting their work and you're seeing, oh, this is what this person is doing. So that in case you want to do something in the similar nature, or you're doing a project and you're stuck, or you need advice, or you need something like a learning experience, you're able to reach out to the different Period Equality Network members. But also, lastly, as I finalize, we're also able to work with members within our project. We're able to work with some of the members in the Period Equality Network. For example, when we're doing the sanitary pads, the reusable sanitary kits, we're able to buy from one of the Period Equality members. But also the positive to that is, after buying, realize that yes, we're training these girls on how to use reusable sanitary towels, and we're buying, like giving them the ready-made products. How about we start making, like teaching them to make their own? So now we are able to train young girls, we're training young girls how to make reusable sanitary towels, both for their own use, but also to sell and get some income. Thank you so much.
Thank you so much, Christian. And I have been seeing people asking questions. Please jot them in your journals. We will have a time for questions and answers. But we are so proud of you, Christian. We are so proud of Defora. We are so proud of your community. Thank you for the amazing work. So my dear panelists, we only have 10 minutes. So I'm going to give each one of you 2 minutes, because we have to keep time. As you know, Period Equality Network members, we are so transparent. So when we say this is it, then it's it. So I'm going to invite Dawn. Dawn, please let us know how the network has contributed to a strong mental health movement that is promoting both mental health and menstrual health. Please, Dawn, I'm going to give you 2 minutes. Okay, I think Dawn is not on the call. So Esther, would you like to chip in? Esther Wambui, you can tell us how the Period Equality Network has also contributed to a stronger movement in, girls' leadership, feminist leadership, policy advocacy. Zamara Foundation seems to be everywhere in all these thematic areas. Over to you. Thank you.
Oh, thank you. And, so glad that you say that, and you're making me really shy. And I'm sorry, I'm timing also myself to make sure that I stick to the 2 minutes. That's how I want to keep time. I think for me, really, I think to just also start by how we've also benefited, and we are not, among the partners that really got the grant. But then you might ask yourself, oh, you didn't get the grant, so how did you really benefit? And I think for us, really, one of the things that we've benefited from being in this community is also the strengthened advocacy and learning in our work of menstruation justice and equity. And that, we all are working together. When we do advocacy, then at least, there's that solidarity and collective action. That then also for us, our capacities have increased when it comes to peer learnings. I think my predecessor also spoke about the peer learnings from each other. And because we come from the different contexts, you realize that then, from the East Africa, for example, if from Uganda, then you're able to pick, some learnings from there. And then, of course, the aspect around fundraising together, and also being able to participate in, advocacy and joint, convenings like the COVA conference that you're part of it, co-creating the menstruation health management first symposium, participating and being a panel within the Global Periodic Poverty Forum. And I think for us, that has really shown how we've been able to really strengthen ourselves as an organization that does work around, that is audacious around work around menstrual justice and equity, but at the same time, how we also to work with others. And maybe just to also mention, the other aspect it talks about movement building. So what do we think will ensure that this movement continues? Of course, we would want the movement to continue being bold, being audacious when it comes to advocacy on menstruation justice and equity. We want that there should be more investments in grassroots movements and communities that directly support women and girls so that then the change is really sustainable. At times, you need to be able to support where the work is. And if that continues happening, then, we can be able to continue build the strong movements. And then, of course, we need also priorities on menstruation. So for funders to really prioritize East Africa region as, you know, a region where we need to really put our investments when it comes to menstruation health, justice, and equity. And in doing so, we'll continue building this as strong period equality movement in East Africa and beyond that continues to be really audacious, bold, brave, and really challenging systemic structures that continues to perpetuate the inaccessibility, inaffordability of menstruation health products, but also the whole holistic of menstruation health management. Thank you very much, and I'll stick to my 2 minutes.
Thank you so much, Esther. And actually, you've been able to answer the last question, because our top priority next is to be bold, brave, you know, and, you know, we are going to make sure that we rock this African region. Thank you so much, Esther. I will request Charles. Charles, I'm going to also give you 2 minutes. Please let us know how the Period Equality Network has contributed to a stronger SRHR movement. Thank you.
Thank you, Patricia. Unfortunately, I don't have a timer, so I'm really sorry. I made go beyond 2 minutes.
I will be the one to hold, you know.
Okay, that was a joke. Yeah. Now, I don't know. If I was physically there, I would really ask everyone to clap for Irise International, because I'll tell you why. Maybe some people can send emojis. I'll tell you why. I started the MHM work way back in 2014. By then, I don't know whether I've seen Nakabugo here, Kathy. By then, we only had the MHM steering committee, the national steering committee at the Ministry of Education, as like the only platform that brings together everyone. But we had a challenge with that because this is a government entity. And, you know, if you want to account, you want to do social accountability or what, it's a government. How are you going to, you know, account and all that? So until when I think, I don't remember when period equality came in, but about maybe 2-3 years ago, you can guide me. But we didn't have a civil society-led, independent-led platform. And this is the very first of its kind in Uganda. And it's not just a network, but as everyone has been saying, it's a platform that shares learning and best practices. But also I've seen people and organizations, small grassroots organizations that have been funded, their capacities have been built before they had maybe dreams, they had work plans on paper, but you people came on board and supported them with money so that they are able to, you know, put as their ideas on ground, and they've been able to support many girls, as you heard from Christine. And so for me, I think that has been a plus, and I want to really applaud Irise, and to also ask you kindly, I don't know whether we have the top leadership here, but I would really kindly ask you to scale up this, you know, scale up the small grants to, if there were 7 organizations, to maybe ×3, ×4, you know, all of us. I've not been a beneficiary, but maybe in the next phase, I can be a beneficiary. So let's continue to, you know, get more opportunities for that. So for me, I would just applaud you, Iris. Thank you for having this. We had so many alliances on HIV, alliances on GBV, but there was no alliance specifically tackling MHM. The only one I think that was similar is the WASNet, but we know WASNet is generally looking at WASH, water and sanitation and hygiene, but not, you know, mainly menstrual hygiene. So I really thank you so much that you've brought this as a very key issue. And before I go, I would also want us to ensure that at least we strengthen our advocacy. Now that we have the 16 days of activism, this is a time where we, you know, where we should be everywhere talking about MHM. So maybe next year we can plan better on how we can move forward with the MHM agenda, so that these 16 days, everyone can see period equality everywhere, advocating for the rights of girls. Thank you so much, Patricia.
Thank you so much, Charles. We really appreciate your feedback. And just to let you know that the discussions of having the period Quality Network were around 8th March in 2021, and then we were fully established in April. So we are just 1 year and a few months, but because of the network members who are here, we are, strong. I think for me, the credit goes to the network members. Like, we are ever ready. We are ever ready to take action. So all we need is, support, and we really appreciate you. So we have 2 minutes to the end, and I really want to keep my time. I would like Christine to tell us one top priority that DEFORA has, Christian, one top priority that DEFORA has for the next, for the Period Equality Network movement in East Africa. And then after Christian, I will request Dawn, just one top priority, then Esther, and then Charles. I just want you to just use 1 minute, and then at 2:30, I'll be able to close my panel. Over to you, Christian. What is your top priority?
Actually have to, but I can say one, okay?
Yes,
I would love to see like a movement or like campaigns happening every year, whereby like the Period Equality Network members have, because right now we mostly meet on platforms, but where we can come together and have a certain activity or certain campaign we're all doing together, like to put across our message. And then another one, let me just bring it up, my minute is not yet done. The other one is also having learning exchanges within the Period Equality members, both within maybe in Uganda, in East Africa, but across the globe. So not just coming here once in a while just to share, but having like a periodical time, like we say in this, like maybe quarterly or annually, but quarterly will be better, or a certain time, like we all come together and share our work and learn from each other and see, like learn new approaches, new strategies on what the different TPEN members are doing. Thank you.
Okay, thank you, Christine, for the recommendation, but I hope you can, we will work together to contribute to this priority, since this is the priority for the network. So I'm going to request for 2 minutes from the people online. Please, just 2 minutes to at least allow my 2 panelists to conclude. Dawn, are you there? What is your top priority for the Period Equality Network movement? Just for you as an organization. If Dawn is not there, I'm going to request Esther. What is your top priority at Zamara Foundation? Oh, Esther, you're muted. Esther, you're muted. Or, okay.
Okay, great. The host was to unmute me. Yes, for me, I think the top priorities are opportunities for shared learnings, so that then we can have continuous network members meeting. And I think for me, really, the major one is really strengthen investments, like increasing investments into the network, into individual and grassroots organizations, so that then as we continue doing this work, then we are doing this work from a shared value, and we continue to really ensure that there is the realization of menstruation health, hygiene, and justice and equity for all women, girls, and gender expressive persons. Thank you.
Thank you so much, Esther. Charles, are you there? What is your top priority as Tahi and Afrian?
My top priority, Patricia, is influencing budget, MHM budget financing. It's really a huge problem in Uganda. I feel like it's not a priority. It's all our, I think it's up to all of us to ensure that we advocate for MHM MHM financing, so that schools have facilities, washroom facilities, but also emergency pads. So for me, that's the main thing. Thank you.
Great. Thank you so much, my dear panelists. Are you there? We need to see you again. Thank you so much, the dear listeners, the stakeholders who are here, the network members, the Irise Institute East Africa team, the Irise International team, everyone here. We thank you so much for listening. We appreciate you. If you've not spoken, please, there is a time for question and answer. If you've not understood anything, you can use the chat box, and Wish you all the best. Thank you. I request Lillian to take over the next session. Thank you.
Thank you so much, Patricia. Thank you so much, all the panelists. That was a very engaging kind of sharing. We really appreciate your time to share with us from your point of view how things have been moving. There is a lot of learning. Thank you so very much, Charles, Esther, Christine, and Dawn, and Patricia, the facilitator or moderator for that session. Well done. Let me just invite in Emily again to take up the next stage.
Great, thank you. So we've got some time now for a more discussion-like session. We had so many written submissions as part of sign up, and we've had loads of questions and comments, so I think we're probably not going to get through everything, but what we will do is somebody's noting down everything, and so we will try and follow up on everything even if we don't manage to discuss it today. But Jen very kindly went through all the written submissions and that you guys made, and there were two kind of key themes that came out. So one was working with global allies and thinking about how global allies can champion and amplify these kind of grassroots voices and these grassroots priorities. And the other was around new evidence and innovation and how we can do more to kind of integrate menstrual health into other areas and other sectors. So we've picked a couple of people to kind of represent those key themes that came out of all the comments that were submitted as people signed up. So we'll do that first, and then we'll try and take address some questions and comments. And we'll follow up on what we don't manage to get through. So I'm just going to hand over first to Arundhati, who's the coordinator of the Global Menstrual Health Collective, to share her thoughts on working with global allies. So over to you, Arundhati, and Callum, you might need to unmute her for us.
Thank you so much, Emily, and for the Irise team for having me here today, and a hearty congratulations to all of you at TPEN for the fantastic work. It's been great hearing you speak. As Emily says, I'm the coordinator for the Global Menstrual Alliance. That is it's a global advocacy group that's pushing for greater attention to and investment in menstrual health and hygiene across the board. Now, Emily, you asked a really great question, but also a hard question to answer. That is, what is the role of these kind of global alliances in raising the voices and raising the insights, evidence, and experiences of all the organizations and the individuals that we've reached? I think global alliances play a really critical role here, and we have to figure out how better we can raise the voices of grassroots feminist movements in countries. So a few things which I heard in the discussion today that really caught my attention. One is we do have to shift the way we think about evidence. We often think of evidence as robust, rigorous research, but what I heard from practitioners today is that there's a lot of programmatic insights, voices from the field that contribute to the evidence base in a different way. So one is, how can we, I think your report and other reports help to bring that together. So look at capturing that. Secondly is, I think because grassroots organizations always have, they're deeply embedded on the ground, they have a lens on new and emerging issues related to menstrual equity, as well as other menstrual health issues that are facing, that girls, women, and others are experiencing. And that to kind of bring that up so that it can drive greater evidence generation, greater interest in exploring those issues. The third is this use of these, small community-based, small funds to support community-based activities. And that got me thinking that typically as global networks, we're often after large pools of money, which sometimes come our way, which is great, but which do not come our way. So perhaps to also rethink how we are our fundraising efforts, to look at both large donors, but also how we can pool together or identify smaller donors who can be interested in supporting the kind of movements and organizations that we heard. Now, as a global platform, I see us at GMC and as others playing a critical role in a couple of ways. One is that we do have the opportunity to be a part of various global forums, events, conferences, and that offers an opportunity to feature speakers from grassroots movements. And I think we need to be more conscious about including them when we are doing conference sessions. The second is there is a group within GMC that is comprised of researchers, academicians, who are always interested, who are pushing for greater evidence generation. I think another thing to do is to figure out how they can also partner with some of the grassroots organizations to explore some of the research questions that you may have, but also to, for example, the scale that's been used, the menstrual practices scale, pool experiences across organizations, across settings where this may have been used, so that we're able to learn from that. I think the third thing and the big one is in looking at the investment case for menstrual health and for menstrual equity, and how do we do this? And here again, I think I saw mentioned in the chat box that we do have to explore the role of the private sector, which is something that we haven't done very well. We're going after the traditional donors, the foundations, philanthropic organizations, philanthropic collectives. And while I think that we should pursue those routes and make a stronger case, I think we need to open up to looking at the private sector, because that's also a very diverse and a heterogeneous group of actors, and look at how they can play a role in supporting grassroots movements. So yes, so I want to leave you with some of my, my top 3 kind of recommendations for how I think that we can amplify this voice. And I think, sorry, I'll end with this last one, which is, I think it's also important that, global alliances, global networks are present in forums such as today, so that we're able to hear directly from individuals doing such fantastic work. Oftentimes, we're only participating in very large global level organizations. It's time to change that. So I really thank Irise for inviting me to be a part of this wonderful conversations and allowing me into the lives of these fantastic advocates. Thank you, Emily.
Great, thank you. And now over to Inga, who's a professor in international human rights law at Central European University. Over to you.
Thanks so much. Thanks so much, Emily, and thanks so much, everyone, for inviting me. I mean, it's such a privilege to be here and just to be able to listen to you. I think what this shows, I mean, over the past 2 hours or so, I mean, that there is enormous potential in the menstrual movement. I mean, it's a movement that's becoming stronger, that's becoming more diverse. So I found the discussion really invigorating. So thanks so much for that. So my particular interest is really in linking menstrual health, menstruation with human rights and gender justice. That's my background. And I've been working a lot at the international level and trying to make these connections between what's happening at the global level and the local level, and to really think about how we can embed the menstrual movement in other movements, linking it to sexual and reproductive health and rights, linking it to gender justice more broadly, making it a more intersectional movement that looks into disability justice, racial justice, makes all these linkages. Now, concretely, I mean, that means that I've been doing a lot of the work that Arundhati also mentioned, bringing menstrual health, bringing menstruation to global forums, and I think there is a lot of opportunity to do more of that, to have sessions at the Human Rights Council, to have sessions at the UN General Assembly, at the High-Level Political Forum on Sustainable Development Goals. A lot of that has happened in pre-pandemic times, and I do think that there is an opportunity to do more of that, to raise the visibility of the movement, to use these platforms for advocacy, to be able to connect with stakeholders and states, and to also connect within the movement. I mean, from the East Africa region to many other regions. I mean, whether that's in Latin America, whether that's in South Asia, where we have really strong menstrual movements. And the second thing I'd like to mention is ongoing work that I've been doing with the Foundation for a Just Society, that some of you have been been aware of. So the Foundation for a Just Society is a US-based foundation that's interested, I would say, in getting into the menstrual health space, and that's very interested in movement building and supporting grassroots movement and strengthening the movement. And what they're doing at the moment is a first round of small grant making, but beyond that, they're really interested in strengthening cross-regional alliances, in getting people together, in supporting convenings, maybe in supporting a larger gathering or conference at a global level. So it's really this idea of bringing people together. So I think they would be another key partner in this space. So I leave it at that. Thank you so much.
Great, thank you. And so the second kind of key area was this idea of new evidence and also innovative ways people are integrating menstrual health into other areas of work. So we're going to hear from Kathy from UVRI in Uganda, and then from Laura at Tackle Africa, and finally from Elizabeth at the Women's Pro Bono Initiative. So Kathy, if we go to you first.
Thank you, Emily. I hope you can hear me.
Yes, we can.
Okay, thank you. I'm happy to be on this forum today. And happy to talk about new experiences and innovations in MHM. And we are currently doing meniscus, which we call menstrual health intervention in schools, in 60 schools in Uganda. And the purpose is to do research. We had a pilot study previously, and from the pilots, we developed a meniscus intervention. And now we are trying to test it in a cluster randomized trial in 60 schools in Uganda to see whether it is feasible and acceptable. And if it works out, then we plan to scale it out nationally and regionally. So this meniscus intervention has a number of components, like most of you have already mentioned. We are working with the Ministry of Education, which has a puberty training manual, and we are using this to be able to train the teachers to deliver puberty education to the girls and the boys. We also have the menstrual kit, which is given out by our implementing partner, Womena. This involves both reusable pads and also an opt-in menstrual cup when the parents consent for the girls to receive this. We also do trainings, and these are TOTs where the implementing partner trains a few people in the different schools, and then these go back and train the beneficiaries on menstrual management and also the use of the products that they have been given. We also have a pain relief component where we give painkillers, we give ibuprofen and also paracetamol, but as well as train on other pain management methods. We do simple wash improvement, like someone else had already mentioned, where we install broken doors, put locks on some of the doors on some of the changing rooms. We give toilet paper cages, sanitary bins, and also work closely with the schools so that they can monitor this. So from the pilot, we noticed that there's a big challenge when it comes to improving wash in schools, for schools to be able to maintain this. So in the trial, what we are doing is we have the menstrual health action groups, which are comprised of the school community, and these are responsible to ensure that whatever we have given out in the intervention schools is monitored by the schools. And the purpose is to improve sustainability. We know that most times these things can be provided, but at the end of the project, we are not sure whether the schools or the girls continue using the different intervention components that you have been given. So we hope that at the end of this trial, we can be able to assess and see the sustainability and also the utilization of most of these products, with plans of ensuring that these different schools and students can be able to continue. So we know a lot of research has been done, but doing a cluster randomized trial, I think, is a very good idea for us to be able to know whether whatever is being provided in these different packages is actually essential for the girls and also can be sustainable. but as well as also working with other people that are already in the field of menstrual health. For example, we are partnering with Women Uganda, which is implementing the intervention, but also working with the Ministry of Education, the Ministry of Health, who have really good policies and strategies, but sometimes they do not have enough funds to be able to implement this. But that's where the NGOs and other organizations can come in and be able to support the ministry so that we can see improvement of menstrual health in both schools, out of school, and within communities. Thank you, Emily.
Great, thanks, Kathy. Kathy, over to you, Laura.
Thank you very much. I'm aware of the time, so I'll keep it brief. My name is Laura Brooks. I'm the East Africa Program Lead for Tackle. And our NGO works in 10 African countries, and we use a sports-based approach to reach young people and hard-to-reach populations. Why do we use sports? We know that young people love sports. I'm sure there's many people on this call, many of whom I know will be playing team sports in their spare time. So we do this in two ways. We train a network of coaches. Now, these could be games teachers already within schools. These could be community sports coaches, netball coaches, football coaches, and we train them on an innovative way of delivering information and services. Now, all our work focuses on sexual and reproductive health and rights. And we've been working for 20 years. We actually turn 20 next year, but we've only been working in MHM for the last couple of years. We were always asked to do menstrual hygiene management, and we've never really started it until the last few years. So our sessions have a mix of information, and then after the football sessions or the netball sessions, we use that as an opportunity to hand out either services, for example, HIV testing, or in this case, pads or links to where people can get pads or cups or any other services. So our strength is access to young people. We can, every week, we can get hundreds, thousands, sometimes at our tournaments coming together. So we need partners, basically. Partners who can come to our events, partners who can come to our tournaments and see the access that we're getting and what can people provide. I heard, I think it was Dr. Arundhati who said we need to focus a lot more on the private sector. I completely agree. We have a lot of private sectors that come to our tournaments. It's a way for them to reach thousands of young people. These are the consumers of tomorrow. The other thing I wanted to just talk about is our coaches come from all walks of life. We use football coaches and netball coaches because we know that young people really look up to sports coaches. They want to play for their coach. So those coaches become the trusted role models. We know that there's a lot of distrust, especially when it comes to sexual health and reproductive health, for young people to go to maybe formal healthcare providers. So we capitalize on the fact that they love their sports coaches and they want to come every week. So I would be very interested in partnering with any of the organizations here. If you need an innovative way to reach young people, then we have a really good sports model. That's our expertise, but we never work alone. Thank you very much.
Great, thanks, Laura. We've actually been doing a lot of stuff with sports in the UK, so that's really interesting to hear. But over to Elizabeth from the Women's Pro Bono Initiative.
Yes, thank you so much. Good evening, everyone. Thanks so much for this opportunity. I'm Elizabeth Achola. I'm a lawyer working with the Women's Pro Bono Initiative in Uganda. As an organization, our main work is around providing access to justice to women and girls. And our main areas are also around SR and HR. So regarding, as far as our work around menstrual hygiene goes, it's around doing advocacy on the same, but we use public interest litigation to advance menstrual health and rights. In this way, we do it by, we do the community engagement. We always, all the projects that we do the needs assessment where we, whatever activity we come up with is informed by the community initiative. So in this regard, there are different projects we are doing in prisons, women in prisons here in Luzira and Chigo prisons. And then also there are women in refugee settlements in the country as well. So with the legal tools that we are using in providing them with access to justice, letting them know about their human rights, and letting them know basically the different means of getting access in whatever area of their lives, we incorporate these trainings with menstrual hygiene kind of trainings where we provide, we not only just talk about their rights as far as menstrual hygiene is concerned, but we also incorporate it with the toolkit where they can train themselves and making the reusable tools. So our main work around menstrual hygiene, we incorporate the public interest litigation bit, the legal tools, but incorporate it with the way they can make pads and recognize that menstrual hygiene is a human right. And if the child doesn't if a child doesn't have access to menstrual hygiene products, then their rights to health and education is being infringed upon. So for us, it's very important that the people we work with are able to know where their rights are derived from and what opportunities they can have as long as they know the right thing to do. That's why we work hand in hand with different members in Period Equality Network, with some of the members of government. We work together to come up with different ways that we can teach the people in the community, but also incorporating it with the initiatives that are around menstrual hygiene, because our work is always around women and girls. So basically our work is around that, using the legal tools to advance our menstrual hygiene. We were thinking about taking this strategy further into the courts in Uganda. We've been doing research. We've reached out to different members, trying to look around, is there a way that the government can be held accountable? Is there a way that can bring the government on board to provide free menstrual hygiene products to the girls, to those in primary and secondary schools? It's something that we are still researching on and looking into, and maybe with time we may take it further in court. But for now, we are just doing the community initiatives, but incorporating it with the legal tools. Yeah, because it's what we are doing at the moment. So, just in summary.
Great, thank you. So I wanted to go to Tabitha now, because she had a few questions. Tabitha from the Waterloo Foundation had a few questions for the TPEN network. And Tabitha, I wondered if you wanted to ask them, and then maybe Patricia, you could nominate some of your panelists or some other members of the network to answer them before we finish.
Hi.
Sorry to put you on the spot.
Hi everybody. Sorry, I can't actually scroll back up to see the questions, but I think I've got a note of them here. There was a few of them, so I'll say all of them, but it might be the case there's not actually time to talk about all of them in this chat. So please feel free just to pick out any ones that you've got a particularly interest in responding to. So the first one was around menstrual hygiene products. There's a large number of organizations here, many of whom are involved in either producing or just increasing access to these. So there's a question around whether there is a role for the network to think about if this could be done more effectively across organizations. So can the group think about increasing efficacy by scale? So for example, if there's particular materials that are used for producing those pads, can these be ordered in bulk to benefit across members? I mean, I guess when, you know, rather than recreating the wheel each time for a new group to start up by producing their own pads, can learning be shared from other organizations who've gone through sort of the sometimes painful process of producing a pad that maybe isn't that effective, and then slowly improving on that? So that's one question of, can more be done to increase the efficacy of pad production across the group as a whole? A second one was an interest in finance streams, and this is a question I think sort of, or similar questions have been raised by a few others. So there's difficulties in relying on grant funding in the longer term, and how do you make menstrual hygiene products available to all, particularly, well, potentially for children in schools? Are there any examples of organizations that have established alternative funding streams? So either finding that schools are able to make some of their budget available. Is there the potential for more advocacy focusing on that? Is that something that across the group, if there is a need and a value of that, having a united voice for more finance flowing through schools or other institutions for these products, is that something that could be looked at? And then the third one was around digital communication platforms, specifically related to menstrual health matters. what exists? Is this sufficient? Is there more potential to think about digital communications reaching large numbers, either through apps on phones, providing sort of videos for information and addressing taboos and stigma relating to menstrual health? And I think there was one, and I know somebody sort of spoke about an interest in having more funds coming through and sort of financial support for grassroots organizations. As a funder, I suppose it's really interesting for us to know what form of funding is most useful. You know, if you're thinking about duration of funds or size of funds, or what does that funding look like that you find most useful? So yeah, as I said, not expecting answers to all, but if there's anything that could be picked out from there, that would be great.
So I don't know, Patricia, if you want to kind of nominate, we'll have, I think we'll just take a few minutes because they're really interesting questions. If you want to nominate either some of your panelists or other members to comment on some of those, or if people want to comment in the chat or raise your hand as well.
Thank you so much, Tabitha, for the questions, and thanks for clarifying that some can be answered now or some we can wait. My panelists, I think among my panelists, the people who raised, that was Esther and then Charles. Charles, if you're on the call, please let me know so that you can respond. Yes, over to you, Charles. I think it would be good for you to answer the aspect of more funds coming in.
Hi, Patricia. Okay, I just wanted you to just re-echo the question.
So I think the question was about the kind of funding that would be useful, both in terms of the duration, I suppose the purpose of funding, kind of thinking about what kind of, and I mean, what kind of funding would benefit the kind of TPEN organizations the most.
Okay. I hope I'm loud and clear. The kind of funding, is this in aspect of what the network members would prefer, the kind of funding? If that's the case, I would really think that we need funding that has maybe less restrictions, because most times we have member organizations like still growing and they have weak systems in place and not so much work done maybe in the past and all that. So if we have funding, let it be quite friendly for even growing organizations to be able to tap into it and able to have it with them. Yeah, thank you.
Thank you. Thank you so much, Charles. Lillian would also like to add on something.
Wow, thank you so much, Patricia. Thank you, Tabitha, for your key questions. Dr. Arundat, thank you. And Ina, thank you. So for me, I think I want to just touch base with a few on what Tabitha has raised about the standardization of products that can be distributed for all those that are really working with communities. This is kind of a very wide topic that has been ongoing, but given the demands that most of the very vulnerable communities that really need and cannot afford such products are very far away in places that are hard to reach. And these organizations that are gathered here are the ones at that central place where it is easier for them to work and connect with these kind of populations that we want to reach. And so the government has put standards for reusable pads, for menstrual flow cups, that we've been participating through, including all the members here that we have been able to mobilize to come and speak their views, including like recently, I think last week, because we've been advocating for tax exemption fully from some of these products so that they are able to come in without running from one office to another to clear and get permissions. Finally, government came around and removed all taxes concerning menstrual products, including the floor caps, because that has always been like a challenge to move from one office to another to get clearance. So in regard to standards, I think it will be very, very hard for the small organized groups like you have seen here. We have some like Kathy, I think, from Direct Hands, who benefited from one of the projects, but as a Period Equality Network member, she had to go through the national training program to get the standards right. But how can we ensure that those small groups are able to maintain those standards remains something that will be on our table for us to discuss. When it comes to funding, I think for menstrual health, there is need to have that flexibility in funding mechanisms. Like you have heard, most of these organizations that we are working with are very small. Some of them are grassroots based. And so looking through the systems, the processes, to go through a competitive process. That's why you saw that many good ideas came around in the pilot project, but because of the processes of sieving, and we could only stay by our word and give those that we have described that would be able to benefit following those kind of rules, or like we spelled out what we would be looking out for. But there were so many applicants. And so the next thing would be, how do we scale up to have many more TPEN members benefit from the funding, even if we are calling them small grants. It's bigger, it would be more beneficial for us to scale up and have people in Uganda, people in Kenya, people in Tanzania, so that everyone is feeling they are part of this movement that we are profiling. For now, we concentrated mostly in Uganda, but like you have heard most of them share, we have been able to mobilize them to platforms where they can give their voice in order to know how to go about it. Thank you.
Great. I'm going to have to wrap it up there because we've run over by 5 minutes. But I think what we'll do is we're going to send the report around to everyone who registered to the event. And I think we'll also send an opportunity for further feedback and comments and on some of the questions that have been raised, because there were other questions in the chat as well. So we'll pull together, we'll send all the final documents and an opportunity for everyone to kind of make some contributions on some of the questions and thoughts that have been raised during the session, because I think that'd be really useful and really interesting. And I know Patricia's messaged me asking, can we do a final photo before everyone leaves? So if we could all turn on our cameras and just see everyone's lovely face and get a final wave, I think that would make Patricia very happy.
Thank you. Thank you. Just keep smiling.
Oh, everyone, you could wave.
Oh, yeah.
Oh, Jen's doing one more. Sorted. Great. Okay. Well, I just want to say thank you so much. We were overwhelmed by the response, overwhelmed by the volume of submissions and questions. And so we will follow up, and there will be, yeah, like I say, more opportunities to discuss some of the things that have been raised. But thank you so much, everyone, for your energy, your passion for this kind of movement of change. Thank you. And yeah.